Hi, welcome to POV. Today we're going to be talking about hospital procurement and the bigger picture of the healthcare system. You might want to buckle in for this one because it gets deep. So let's get it. Early last week, in an unprecedented move, senior doctors in Harare staged a surprise protest that put Health Minister Obadiah Moyo and the Paranyatwa group of hospitals management on blast. Doctors and specialists took turns airing out their concerns over the horrific state of public hospitals in the country. Dr. Aza Mashumba, who is the head of pediatrics at the Paranyatwa group of hospitals, broke down, giving an emotional speech on the dismal state of healthcare in the pediatrics department. The speech went viral and was led to Zimbabweans casting fresh eyes on the dire and disgraceful state of our healthcare system.
There is no urgency, there's no priority, and nobody is listening to us. I've written 1 million lists, I've knocked on 1,000 doors. I come to work and I do my very best, but my output are stillbirths, my output are disabled babies. Elective lists are not being done. We wait for it to become an emergency. When it becomes an emergency, I'm given a baby who has hypoxic brain injury. This child now has permanent disability. This is not acceptable. Then we need to put a pedal on the accelerator and get things done. These meetings, these talking, these lists, we need action. Amen.
The tender system is killing people. Now, what does that mean, really? Let's start there. It is a standard international practice for governments to engage in a tender process for the procurement of drugs, medicines, maintenance services, equipment, and resources for public hospitals. It is believed that the tender process allows for the following. Number 1, the procurement of the most cost-effective drugs in the right quantities. 2, selection of reliable suppliers of quality products. 3, the assurance of timely delivery. And lastly, the use of the lowest possible costs. So tender processes are good and essential things. However, they don't seem to be very helpful in Zimbabwe. In Zimbabwe, the tender process works as follows. Using guidance from the essential drug list of Zimbabwe, a hospital's procurement team will put on a list of medicines it needs. The list will then be put out to tender, where local and international companies can send through tenders in the form of quotations to win supplier contracts. Once 3 quotations have been selected, these companies' quotations are sent to the government, who are then going to sign off, and once sign-off is approved, the government will then release the funds to the hospital to carry out the purchase. I know, it sounds tiring. And this process, as you've probably guessed, can take months. In 2017, Health and Childcare Deputy Minister Aldrin Masiwa said, and I quote, "The tender process in this country is very slow, and for us in the medical field, we would want a situation where if we have the money, we would immediately procure the medications to make them available to the public." He would also go on to say, "But naturally, as a government institution, there are regulations we have to go through, including the tender process, which can take some months before we can procure medications." That's right. Even if the money is there, the hospital cannot exercise its own judgment to go and purchase drugs. Instead, the onus is then put on the citizen, who is then told that we don't have this, so go buy it. So at the heart of the concern around tenders, Dr. Mashumba was insinuating that this slow bureaucracy is affecting doctors' ability to deal with emergencies, hence the millions of lists and thousands of doors. And even if you try and rush the process, some emergencies can't wait longer than a few hours. So the tender process is killing people because the tender process is slow. Now, we decided to go and see what this meant for ourselves. I went on a visit of Harare Hospital, and what I saw and learned was crazy. As I was confirming my visit, we learned that the electricity had gone off and ICU patients who were on ventilator machines had to be moved. It took an hour for the backup generator to be turned on, and in the interim, nurses had to manually pump oxygen for those patients. When I arrived, the water had been shut off. There was no running water in the hospital. In the maternity ward, I learned that there were certain toilets that had not been functional for months. The whole hospital has 2 functional ICU beds, and I doubt that has changed since, which means that if you arrive at Harare Hospital right now and need to be checked into the ICU, chances are you're going to be turned away. Harare Hospital at best is operating at a rural district level. Perhaps one of the more disheartening things I saw was a live emergency in which a group of Malawans had been involved in an accident and had been badly injured. After being rushed to Harare Hospital, the Malawian embassy had to be contacted to come and make a makeshift plan involving 2 private cars that would drive these injured patients back to Malawi for treatment. Imagine that. They drove out of a hospital back to Malawi because they couldn't receive treatment. As if things couldn't get worse, News of this accident had reached the hospital, and staff were informed that a number of the crash victims were being rushed for emergency treatment, which was confusing to the doctors on hand, who knew full well that there wasn't much that they were going to be able to do for these patients. Harare Hospital has been at the center of controversial issues with regards to the attenders. In 2003, they were part of a 151-page investigations report on the procurement processes by government hospitals under the targeted approach done by the National Economic Conduct Inspectorate. The report stated that there was no ranking system at Harare Hospital, and tenders were not always awarded on the base of the lowest bid, as the criteria is often changed circumstantially, rendering the tender process susceptible to manipulation. So is a broken tender system and corruption the reason why we're in such a dire situation with our healthcare? Certainly not. See, one theory, and a strong one at that, is that the health is simply not a major concern or priority for this country. Zimbabwe continues to have one of the lowest budget allocations towards health in sub-Saharan Africa. This year's budget has an allocation of 8.6%, despite pledging to have it at 15% in the Abuja Declaration of 2001. In stark contrast, our blueprint big brother, Rwanda, allocated 24%, nearly a quarter of the national budget goes towards health. Now, to be fair, only 6 countries that signed the declaration have managed to get their budget up to 15%, and 8.6 translates to $695 million. So if careful review of current allocation structures, systems, and responsibilities is done, that money can go a long way. Only time will tell if it is actually implemented properly. Then there's our broken referral system. We have different levels of healthcare at hospital level. We have clinics, district hospitals, provincial hospitals, and then tertiary hospitals like Pari, Harare Hospital, and Impilo. With the lower level facilities being so few and poorly resourced, a lot of patients get sent to bigger hospitals, causing overcrowding and a rapid depletion of thin resources. So if you live somewhere like Chinoy, and if your loved one needs immediate attention, the district hospital or clinic have 2 options. A, put the burden of care on you to go and find syringes and medicines and etc., which at that point you would hope that the pharmacies in Chinoy have what you need. Or B, refer you to a central hospital, which will more than likely not be able to help because they are overcrowded. Lastly, there's the theory that there isn't enough tax to support the system. But Zimbabweans as is already overtaxed. The real issue is that the economy, being largely informal and unproductive, does not allow for the government to come up with consistent and reliable revenue streams. Hence this administrator's strict focus on trying to kickstart the economy through investors and lifting of sanctions. In other words, they have chosen to go for the bigger picture while the smaller picture items just have to wait it out. Now, is this the best route? And is it working? And if you think it is, please let us know. And if you don't, again, we would like to discuss this. But for the meantime, we can only hope that our healthcare system gets fixed quickly. Because the only way for us to advance as a nation is if we are happy and healthy. And this government has already declared it a national and international right for us to have health. So let's hope that they adhere to that as they move forward. Now, we wanted to use this time to give out our heartfelt condolences to all the families that have been personally affected by Cyclone Shady. And we also want to use this opportunity to give a special thank you to all the companies that are using their personal resources to make the situation better. We're also very encouraged to see individual Zimbabweans using their personal social media to make efforts to help relieve the crazy situation. And last but not least, it's been amazing to see the CPU, the armed forces, and the unity between our parties in trying to get the best results for the people that need. If only that we didn't need special crises like this to show us that Zimbabweans are truly a caring and loving people. Let's hope the situation doesn't escalate and that we get people the help that they need. This is Kuda Mangwe saying good morning, good afternoon, and good night.